so far? Yes, I'm leaving to you on your own readings. Aside from the tooth, napa sa inyong modules like the palate, the tongue, vestibule, floor of the mouth. I'm leaving that to you. I will now focus really on the tooth. So now the tooth. As for the tooth, there are three main parts. We have the crown, we have the root, and then the structure that divides the crown and the root, we have the neck. That's why we have the crown, the root, and we have the neck, or the CEJ. The CEJ stands for cemento enamel junction. Basically, it is a junction of the cementum and the enamel. That's why it's cemento enamel junction. Guys, take note of my discussions. You can take notes, okay? Feel free to interrupt if you have questions. You can chat or you can unmute if you want to talk. Next, we have enamel. The enamel is the hardest substance in the body. It covers the crown. It covers the crown of the tooth. This white portion here, that's your enamel, which is also the hardest substance in the human body. The ameloblast, also you can find it in your modules. The enamel forming cells, we call them ameloblast. Okay? You will know more about ameloblast when you reach next subject. Oral histology, you'll be talking about tissues in the body. Oral histology, microscopic structures. After enamel, we have dentine. The dentine is the second layer of the tooth, and also it forms the bulk of the tooth. When we say bulk, it forms the major of the tooth. Again, take note, the dentine, which is yellowish in color, the second layer of the tooth that makes up majority or the bulk of the tooth. Plus, it's also good to note that dentine, if enamel can only be found on the crown, as you can see on the picture, the dentine can be found throughout the circumference of the entire tooth. You can find it on the crown, you can find it on the root portion. That's why we have coronal dentine on this part. Can you see the cursor moving? Just to double check.
Yes, Doc.
Yes, Doc.
Am I talking too fast or it's fine?
Okay, Doc.
Okay. Thank you. So again, the dentine, can you find it in the entire circumference of the tooth or the entirety of the tooth? You can find it on the crown. We call it coronal dentine. You can find it on the root. That's why we have radicular dentine or root dentine. That's why it makes up the majority or the main bulk of the tooth. Then, take note that the dentine is already sensitive. You can feel its sensitivity. That's why if niluhan mo, it's perhaps na-expose na ang dentine. Okay? And so you can feel sensitivity or the patient can feel sensitivity. Next, we have the pulp. The pulp houses the nerves, you have lateral canals, you have blood vessels. You can find it there. You will know more about pulp when you reach your subject in Band 5, I guess. Kailangan naman yung curriculum back in our time. In endodontics or root canal therapy, you will know more about the pulp and pathways of the pulp. But again, it's good to note the pulp houses the blood vessels and the nerves that will serve as nutrients of the tooth. Then, take note that the main purpose or function, again, the main function of the pulp is formative. Again, take note, guys. I know, layo pa mo take o board exam, but good to note is a common board exam question. The main function of the pulp is formative, meaning it will form something. It will form the dentine. Again, you will know more about tooth formation in oral physiology, and oral histology as well, who form first ang pulp, and you form sa pulp, it will now form the dentine. Again, in the development, mo form first ang pulp, you have the nerves, you have your vessels, and then after that, it will form the dentine. That's why the main purpose or primary function of the pulp is formative, forms the dentine. Understood?
Yes, Doc.
Okay. Next, we have the gingiva. We will just talk on the next slide regarding the common or basic structures, the gingiva. Again, you will know this more when you reach Dent 5 in your periodontology. The gingiva forms a collar around the tooth. It covers the neck of the tooth. In layman's term, we call it gums. Next, we have cementum. If the clinical crown is covered with enamel, the root, and you see this crown, and then you have the outermost layer, which is enamel. For the root portion, the outermost, where the covering is cementum. Again, cementum covers the root. That's why going back, the neck, or the CEJ, is also known as cemento-enamel junction. This is the neck. There's the junction of your enamel that covers the crown. Then you have your cementum that covers the root. That's why it's cemento-enamel junction. Next, you have your blood vessels, part of the pulp. Then you have periodontal ligament. This is the only ligament that can be found on the tooth. When you say ligament, it connects bone to bone, from one bone to another. For the periodontal ligament, the first bone is the tooth, which is typically a bone. Then, the alveolar bone. So, ang nagkupot, what holds the tooth in its position is your periodontal ligament fibers. You have your fibers here, and it anchors the tooth to the alveolar bone. Just to give you an bone to the bone. That's why we try to lacerate and disrupt the connection so that we can extract the tooth. That's just one of the mechanics or ways on how to extract the tooth. But there's more in oral surgery. Then you have lateral canals, then you have the nerve. Next, we have the gingiva. As I said, we'll just discuss few structures regarding the gingiva or the gums. So can you picture this out? This is a cross section. This is the tooth on this part. This is the alveolar bone. Then the red one, that's the gums or the gingiva. This part here, we have the sulcus, which is basically a valley-like depression. Again, sulcus, a valley-like depression. When you brush your teeth and you have your bristles nga somehow mo enter sa inyong gums, that's because there is a depression there. Also, when you eat something and there will be food debris or trap, normally that's because there is still a gingival sulcus. Not the entire gingiva is completely attached to bone. That's why we have free or marginal gingiva. That's why it's called free, because it is not attached. Free or unattached gingiva. Okay? Mustak pa ang food diha, that's free or unattached gingiva. After that, you have your attached gingiva. Kani, this is already attached to bone. This is also pink or light pink in appearance because of its pilit siya sa bone. Doon siya sa bone, that's why it's attached to bone, that's why it's light pink in color. Now, for the demarcation, we say demarcations, guys, boundary. So you have your free marginal gingiva or free or marginal gingiva, which is unattached. Then you have your attached gingiva, kung balikon ha. Your free gingiva, then you have your attached gingiva. What demarcates or separates the two is your marginal groove. Again, this is not very evident. This is just a very small groove. Again, from the free gingiva to the attached gingiva, what demarcates between the two is your marginal groove. Demarcates, again, what separates. From your attached gingiva, you have your alveolar mucosa. Ang alveolar mucosa, this is already part bone na ni dire. This covers the bone, but it is not tightly attached. This is already loosely attached to bone. That's why this is red in color compared to the attached gingiva. Ang attached gingiva, dool kay siya sa bone, that's why it's light pink in appearance. Ang alveolar mucosa is loosely, dili kayo pilit sa bone. That's why it's red in appearance because of the presence of blood vessels. Now, what separates, if the free or marginal gingiva to the attached gingiva, ang nag-demarcates ana is the marginal groove. From the attached gingiva to the alveolar mucosa, what demarcates between the two is your mucogingival junction. This is more evident than the marginal groove. Mucogingival junction separates the attached to alveolar mucosa. Muco, that's for mucosa or alveolar mucosa. Gingival, that's for gingiva or basically attached gingiva. That's why to combine, that's mucogingival junction. Understood so far, guys?
Yes, Doc. Yes, Doc.
Okay, tanawon na to ang gingiva gid sa live patient so that you'll become more familiar. Okay? That part, that blue part, that's free or unattached gingiva. Kato kung giingon nga ang food pwede pa mo-trap diha. That's free or unattached gingiva. After that, you have your attached gingiva, tightly bound to bone. That's why it's light pink in appearance. Makita niyo diri. Light pink, light pink. Kani diri ni red. This is already alveolar mucosa. Again, that's free gingiva or unattached. Next, you have your attached gingiva. Ang nag-separate which is not very evident is your marginal groove. Kanang arrow, can you see the changes from light pink? Focus on the lower part. You have your light pink and then your red kaayo. As I said, that's already alveolar mucosa. That line there, pink and then your red, that's mucogingival junction ng arrow, which is very evident. Maklaro, you have lighter pink and then ada yung certain change in color ni red na siya. Red na kaayo. That's already alveolar mucosa, loosely attached to bone. Naklaro sa picture? Sige daw. Can I have Abigail Pilio? Pilio. Yes? Abigail? We'll try with Alexa. Alexa Chu.
Sir, Doc.
Okay. As I mentioned, the attached gingiva is attached to bone. The alveolar mucosa is loosely attached. Right? It is red in color because of the presence also of nutrients. Our blood vessels, because again, it is not loosely attached. Since dili man ka siya pilit sa bone na ay mga presence of blood vessels, that's why it's red in appearance and it is loosely attached. Why do you think so? Gano ang alveolar mucosa man loosely attached? Any idea lang? No wrong answer. Just idea. Tanawa balik ang picture ha. Ang alveolar mucosa on this side na loosely attached. Dili ka siya pilit na sa bone. Why do you think so? Any thoughts?
Para makatarong og tihok ato ang lips, Dok.
Exactly, correct. Not only the lips, kana nga part there, when you try to retract, going na to the lower part, or topmost or lowest part, it is loosely attached so that the lips and the cheeks can move freely. Try to imagine if that part is tightly attached. When you talk, you cannot expand your mouth. Or when you smile, right? It's loosely attached so that there will be certain mobility of the lips and the cheeks. Ako ha?
Yes,
Back to
Dok.
my screen. Okay, thank you. Okay, the tooth in shapes and in numbers. The permanent, it's good to note, guys, that there are two sets of human teeth or human dentition. Again, two sets. First, you have your primary dentition or deciduous or the milk teeth. Then you have also permanent dentition. Again, there are two sets. You have primary, or also known as deciduous, or milk tooth or baby tooth. Then you also have your permanent dentition. For permanent dentition first, let's talk about the permanent first. There are four main tooth types. First, you have your incisors. For your incisors, there are 4 in the upper and 4 in the lower. That's why you have 8 incisors. Ang kaning upper, guys, is one arch. Again, see the cursor moving from this to this. That's the upper arch. That's one arch, or the maxillary arch, or the upper arch. This one is the lower arch, or the mandibular arch. In other words, the permanent dentition and also with the primary, there are 2 arches, maxillary and mandibular. Another term also is quadrant. When we say quadrant, if you cut one arch, example the upper arch, if you divide it into 2, you have your 2 quadrants. You have your left and your right. So that's why one arch has 2 quadrants. Also with the lower, one arch has 2 quadrants. Therefore, there are 4 quadrants in the permanent dentition, same with the primary. Again, one arch, another arch. If you cut it into 2 into half, there are 2 quadrants in each arch. Okay, now you have incisors. For the incisors, you have 2 central incisors. Then you have 2 lateral incisors. Same with the lower, you have 2 centrals, and then you have 2 lateral incisors. Next, you have your canines. 2 on the upper, 2 on the lower. That's why you have 4 canines. Canines are also known as cuspid. When you say cuspid, cusp, short for cusp, the root word is cusp. Kanang tango, you have your cusp there. Since canines do only have one cusp, that's why we call them cuspids. Next, you have your premolars. Premolars are also known as bicuspids because if canines has one cusp, premolars have two cusps. That's why we call them bicuspids. Again, premolars are also known as bicuspids. For the bicuspids, you have your first premolar or first bicuspid, and then you have your second bicuspid. So again, akong balikon. You have central incisors, you have lateral incisors, you have your canines, then you have your bicuspids. You have first and then the second bicuspid. Then you have your molars. Molars, you have your first molar, second molar, and then third molar. This one, you have your first molar, you have second molar, and then you have third molar. Third molars are also known as the wisdom teeth. Now let's go to the primary dentition. The same thing, you have your upper arch, you have your lower arch, cut it into two, you have your quadrant. You have your left side, your right side. Cut it into again, you have quadrants. Still, you have your central incisors. For the tooth types, you have your lateral incisors. You have your canines or cuspids. However, it's good to note that in the primary dentition, we don't have premolars. Again, note, the primary dentition has no premolars. After canine, in the permanent dentition, after canines, you have your first bicuspid or your first premolar and second premolars. For the primary dentition, after canines, there's no premolars. Rather, you have your first molar and you have second molar. And then you don't also have third molars. Okay? Then I have Aliana Denise.
Doc,
Why do you think na in the nomenclature, or in the tooth types, rather, in the primary dentition, there's no premolars, only in the permanent?
since hindi pa sila nag-erupt, Doc. Kasi diba, lumalabas, diba kasi there is a like, timeline of it.
Again, there is.
A timeline of it, nalalabas siya.
But the question, in the naming, why not make it after canine and then to avoid confusion, make it first premolar and second premolar? Why do you think that the authors or the experts name it first molar and second molar? Why not make it first premolar and second premolar? To make it the same with the permanent dentition.
Pardon, Doc. Ano po?
In the naming of the primary, why not make it after canines? They name it first premolar and second premolar for the primary. Why did they opt to name it first molar and second molar? Why do you think? Okay, we'll try with another Aliana. We have Aliana JC. Any thoughts? Yes?
Molars
Aliana
can
JC.
be replaced, Doc.
Yes. Wait lang sa Sheena. Yes, Aliana JC. Guys, can you turn on your cameras na lang? Because para di na ko ma-interpret nga uban ba they just joined but they're not there. Because in the previous block, na yung mga ana yun. They just joined but actually wala sila diha. That's why I'm calling so that to double check if they're really listening to the discussion. As I said, I will be discussing important, especially when you reach nomenclature or tooth naming. Anyways. Okay, I need to answer to Aboy first or Melvin. Yes, it's fast. Actually, the P1, ang school ang nag-schedule, Ana. Again, I'm just following the schedule of the school as per the major examination. Almost every week or every after week na exam. There's no other time because again, 1 month na yun ang oral anatomy and the rest of the subjects. Yes, Fatima.
Doc, can I answer the question?
Yes.
Isn't it because the permanent molars is nag-erupt siya posterior to those premolars?
Come again. Balik. The
The permanent molars po kasi is nag-erupt lang siya posterior to those premolars, kaya siguro yung sa primary wala siyang premolars.
yeah, but what
Yung
makes
erection.
Okay, actually you're right. The permanent molars will erupt posterior. Okay. However, yeah, thank you for your thoughts, Fatima. But you're right. The permanent molars will erupt posterior, distal to them, to the primary molars. Yes, Muhammad. Isa pa ni Muhammad.
Just call me Aslam for Timar.
Yes.
So can I give it my also to answer?
I cannot clearly hear you.
Wait lang.
Are you in the Philippines? Yeah.
Madunggan na ko to?
Yeah, Madunggan.
Yeah. Can I also give it try to answer? My answer is that why do we call it premolar instead of molars? Because of the deciduous teeth structure, Doc, it doesn't have two cuspids; it has tricuspids. That's why we consider this as first molar, not as first premolar.
Okay. Exactly correct. We call in primary dentition, the molars are called molars instead of premolars. Walay premolars sa primary because the molars resemble more of a molar. Again, they are called molars because they resemble more of a molar instead of a premolar. That's really the answer. Okay? That's good, Muhammad. Just to double check, do you have foreign nationals here not staying in Cebu or not in the Philippines? Kasi sila naman ang allowed na mo take sa special exam na. Just send me a chat, okay? I'll proceed. So, okay na tani? After the canine, they're called first molar instead of first premolar because they look like a molar, a permanent molar. Okay. And yes, sakto to si Fatima nga mo irap dayon dire ang yung first permanent molar when you reach 6 years old. Next, let's further differentiate the primary dentition and the permanent dentition. For primary dentition, we have, for the number of arches, the same. We have 2 arches, upper and lower. Number of teeth for the primary dentition, you have 20 teeth, 10 in each arch or jaw, and then again, 5 in each quadrant. As I said, a quadrant is half of an arch. That's why if 10 in each jaw or arch, you have 5 in each quadrant. For the permanent, you have 32 teeth, 16 in each jaw or arch. Half of that, you have 8 in each quadrant. So 20, and then you have 32. For the duration, the primary dentition will erupt at 6 months. So normally at 6 months old, ang bata matubuan ng ngipon. You have 6 months until 6 years. The permanent dentition from 6 years and beyond. It depends kung kano sa mo matangtang or ma-exfoliate ng ngipon. So from 6 years and beyond. Now for the eruption sequence. Again, focus on this, guys. Okay. This is the pattern or the eruption sequence for the primary first. Again, for the primary dentition pa ni siya. You have A, B, D, C, E. This is for the upper. And then this is for the lower. Again, now you divide niya. This represents the upper arch. This represents the lower arch. Again, this is just for the sequence, guys, kung unsa ang ngipon ang maguna, but there's really a time for this. For now, just focus on the sequence kung unsa ang ngipon ang maguna. For this one, A represents your central incisor, B for lateral, C for canines, D for first molar, E for second molar. So for the upper arch, focus upper arch sa. You have A and B. So most probably the central incisor and the lateral incisors will erupt together. That's why nagtupad sila. That's A and B. After your lateral incisor, you have your D, which is your first molar. So you have central, you have lateral, and then you have your first molars. After that, you have C, canines, and then lastly, you have your second molar. So that's the pattern of eruption or sequence for the upper and the primary. For the lower, you have your A, but this time, in most cases, the central incisors lang mag-erupt. After some time, susunod na din ang lateral incisors. Then after that, same, you have your first molar, and then ang canine and second molars, most probably they erupt together. Nakuha ninyo eruption sequence sa kaninga pattern?
Yes, doctor.
Any question for this? Wala. So muna, in the exam, what if I will ask you, like example, the eruption sequence, yung mga nata, for the upper, central incisor, lateral incisor, and then after that, ni-erupt ang second molar. Is that a correct eruption sequence or not? Dili, right? Kaya dapat first molar mag-una. Then what if in the lower, I'll say lateral first and then central dayon. So that's wrong. So be familiar with this, guys. For the permanent dentition eruption sequence, it's different now. You have your maxilla same, then you have your mandible. 1 represents central incisors, 2 laterals, 3 canines, 4 first premolar, 5 second premolar, 6 you have first molars, 7 second molars, and then 8 you have third molars. For the maxilla, most probably there are 2 eruption sequences. Again, as I mentioned, ang first nga mutubo is the first molar. Sila gina ang first nga mutubo. That's why you have your 6 or your sixes, first molars. For the maxilla, you have 6. And then after that, you have your central incisor, you have your lateral incisor. Then, dili pa mag-canine, but rather mag-first premolar. You have your canine, you have your second premolar, and then you have your second molar. Or, pwede po nga maglahi siya. If this is 6, 1, 2, 4, 3, 5, 7, pwede po 6, 1, 2, 4, 5. Siya naglahi. You have 6, 1, 2, 4, 6, 1, 4. Nalahi siya pag 3 and 5. Dili kay 5, 3. So that means, it's possible that the canine will erupt first before the second premolar, or possible that the second premolar will erupt first, then the canine. Nakuha ni ang lahi kalahian. 6, 1, 2, 4, 3, 5. 6, 1, 2, 4, pwedeng 5, 3. Okay? Can I have a yes? If nakuha ang pattern?
No. Yes.
No? Take note lang guys, 6124, 6124. But it's never 612 then 5. Okay, if mo na kag 612 and then 5, that's why, that means after your lateral, ni-erupt na yun ang second premolar. The first premolar should erupt first. Again, the first premolars should erupt first before the canines and the second premolars. Pero kung mo second premolar gani ang mag-una, 612 and then second premolar, then there is problem. Next, for the mandible, it's a bit straightforward. Still, you have your first molars, and then you have 1, 2, 3, 4, 5, 7, and then nagsunod na 6, 1, 2, 3, 4, 5, 7. Okay? Nakuha ang eruption sequence for primary and permanent?
Yes, sir.
Yes, Doc.
Okay. Next, the tooth nomenclature. Guys, can we have a 2-minute break? Just 2 minutes, okay? Nomenclature. Again, I will be discussing the tooth nomenclature. This is a very important topic from now until you become dentists. Tooth nomenclature, this is the system on how we name and how we number the tooth. You need to be familiar and learn the topic by heart. Again, by heart lang yun kay. From now until sa succeeding years pa, you will be facing the same topic. That's why you'll become so familiar with this. Again, the tooth nomenclature. In tooth nomenclature, guys, there are a lot of ways or systems. However, let's just discuss the 3 common systems used. First, you have universal numbering system, which has been adopted by the American Dental Association or the ADA. That's a universal, in short, that's universal or ADA. Again, universal or the American Dental Association ADA. Next, you have your Federation Dentaire Internationale or the FDI, also known as the International Two-Digit System, FDI or ITDS. Again, FDI or ITDS. Take note of this, FDI and ITDS, because in the Philippines, this is the one we are following. It's good to know and be familiar with other systems, but just take note that the FDI or the ITDS, the International Two-Digit System, is the system that we are using in the Philippines. Last, you have Zygmundi or the Palmer notation system, which is the least familiar or common. Wait. Para dili ko makalimutan ni, remember you have FDI and ITDS. Puro sila na I. Good to know. Universal or ADA. For FDI, para dili makalimot, FDI, II. ITDS na agapoy I. Let's start first with the Universal Numbering System or ADA. Ang universal, guys, or same with the three systems, lahi ang sa permanent, lahi po ang system sa primary. So let's first discuss the universal or ADA and then permanent dentition. For the universal system and the permanent dentition, they are using numbers. Again, for the permanent dentition universal number system, they are using numbers. The teeth are numbered from number 1 to 32. The teeth again are numbered from number 1 to 32. Question: asa man mag-start? Asa man ang number 1? Asa ang tooth number 1? Tooth number 1 is the most posterior tooth in the upper arch on the right side. Again, tooth number 1 is the most posterior tooth. It means pinakalikod on the upper arch and on the right side. Therefore, this is tooth number 1 in universal numbering system. After that, from tooth number 1, as I said, number 1 to 32. From number 1, from the most posterior on the upper arch and on the right side, you turn clockwise. From number 1 to until 32, you turn clockwise. That's why number 1, number 2, 3, 4, so on and so on. Ako ha?
Yes, Doc.
Yes, it's very straightforward. Ginambiran ang ngipon from number 1 to 32. Number 1, the most posterior tooth on the upper arch and on the right side. Tooth number 1, and then you rotate clockwise. Now, in naming the tooth, when you name na usa nga ngipon, there are a lot of sequence, pero kanilang for uniformity will follow this, and also the book is following this. You start by mentioning if it is permanent or primary. Again, you start with saying it's permanent or it's primary. After that, again, take note of this, permanent is mentioned sa if permanent na siya or primary. For this one, this is permanent, right?
Yes, go.
After that, you mention what arch. Is it upper or lower? Or is it maxillary or mandibular? Focus is number 1. Ang kaning number 1. Is it permanent or primary? Permanent man di ba?
Yes, Doc.
Is it maxillary or mandibular? Maxillary.
Auxiliary.
And after that, you mention which side. Is it left or right?
Right.
Then after that, name the specific tooth type. Again, this is central, lateral, canine, first premolar, second premolar, first molar, second molar, and third molar. So therefore, tooth number 1 in ADA is, sige, name the tooth now. Based on that sequence, naming. For ADA, for the primary dentition. If a universal sa permanent, they are using numbers. A universal primary, they are using letters. They are using letters. It's the same thing. So basically, you start with letter A up to letter T. Okay, there are only 20 teeth, man. So, nuan kag letter T. Still the same. Tooth A is the most posterior tooth on the upper arch and on the right side. That's why that's tooth A. Same thing, you rotate clockwise. That's why B, C, o ha? Same ra gihapon ang system pero letters na lang ang gigamit instead of numbers. Sige daw. Name tooth J. Correct. Cindy Lou was. I'll proceed with FDI, ITDS. Again, atoa na ni guys, this is ours. Be familiar with this. Okay. For the FDI, Federation Dentaria Internationale or ITDS, basically diba, international two-digit system. So basically, there are two digits. Ang two digits each digit represents something. Also, when you mention the numbers or the digits, you mention it by digit. You do not mention it as a whole number. Again, you mention what digit. You mention per digit, and each digit represents something. Now, let's focus on the first digit. Sa two digit, guys, first digit represents the quadrant. Again, in ITDS, the first digit represents the quadrant. Now, pila gani ka quadrant sa permanent dentition? Also with the
Four, sir.
Four quadrants. Now, ang question, asa man ang number 1? Asa ang first quadrant? Asa ang second? Asa ang third? Asa ang fourth? So,
Right quadrant.
Sus ka mga
Right quadrant. No.
Hindi na ko mag-discuss di ay. Okay, correct. First quadrant is the upper right quadrant. Then you have second quadrant, you have the upper left quadrant. Then you have third quadrant or the lower left quadrant. And then fourth, you have the lower right quadrant. So same thing, you rotate clockwise na gihapon sa kanila. First quadrant or quadrant 1, quadrant 2, quadrant 3, quadrant 4. Okay? After that, focus sa one quadrant, kanila nga quadrant. Actually, the same thing with the rest of the quadrants. Kaya again, in FDI, ni focus siya by quadrant. So for the, if okay na ta sa first digit, that's quadrants. Second digit, that is now the specific tooth type. So in each quadrant, guys, ang ngipon ginambiran siya 1 to 8. Each tooth is numbered from number 1 to 8. Asa man ang 1? Ang 1, we have central incisors. All central incisors are 1. Lateral, we have 2. Canine, 3. First premolar, 4. Second premolar, 5. First molar, 6. Second molar, 7. Third molar, 8. Same with this. 1, 2, 3, 4, 5, 6, 7, 8. Same sa lower. 1, 2, 3, 4, 5, 6, 7, 8. So that's why, ang kaningang ngipon, which is a central incisor, that's on the first quadrant, right?
Yes.
So therefore, that's tooth number 1, 1. Because that's the first quadrant and it's a central incisor, that's why it's 1. So tooth number 1, 1. You do not read it as tooth number 11 because again, you read it by digit. Tooth number 1, 1. Then you have lateral incisors and it's on the first quadrant. Tooth number 1, 2. Same with the others, 1, 3, 1, 4, 1, 5, 1, 6, 1, 7, 1, 8. The second quadrant, the same thing. However, mag-start ng 2 kay second quadrant. So that's tooth number 2, 1, 2, 2, and then continue. With the lower, third quadrant, 31, the same thing, the good gapon. Nakuha?
Yes, Doc.
Yes, Doc.
Sige, akong balikon.
Yes, Doc.
The international two-digit system, permanent dentition, there are 2 digits. The first digit represents the quadrant. And the second digit represents the specific tooth type. In each quadrant, the teeth are numbered from 1 to 8. That's why all centrals 1, laterals 2, canines 3, first premolar 4, second premolar 5, first molar 6, second molar 7, third molar 8. Okay? Ano yan, Jego?
Yes, sir.
Name tooth number 25.
Permanent permanent, left maxillary, 1 second premolar.
Correct. Okay, correct. Can I have Dwight Renzo?
Hello po, Doc.
Hello. Yeah. How about 4-7? Tooth number 4-7. Name the tooth.
Permanent mandibular right second molar.
Correct. Correct.
Thank you po, Doc.
Yeah, welcome. Can I have Earl? Earl Jude.
Yes, Doc.
Yeah. Tooth 1-3. Tooth 1-3.
Doc, unsa daw ang question daw, Doc?
Tooth number 1-3. Yeah, name tooth number 1-3.
Pusgi po. Ay, Doc. Daot ako ano, Doc? Dili balik,
Okay.
Doc. Di katapan raming Dwight, Doc.
Tooth number 1-3.
1-3. Sa permanent maxillary right canine.
Correct. That was Earl, right?
Yes, Doc.
Okay. Okay na ta? Nasabtan na ni?
Yes, Doc. Yes,
Doc.
Okay. Let's proceed sa FDI, but this time on the primary dentition. Sa primary dentition, same thing. 2-digit, the first digit represents the quadrant, and then the second digit represents the tooth type. Ang quadrant sa permanent, you have 1-4. For primary, you have quadrants 5-8. Continue lang. If you end with 4, for the permanent, for the primary, you have 5th. Still, the upper right quadrant is 5th. You have 6, 7, and then you have 8. Then for the specific tooth type, the same thing. In each quadrant, the number siya 1-5 instead of 1-8 because in each quadrant, there are only 5 teeth for the primary. So 1 for central, 2 for lateral, 3 for canine, 4 for first molar, 5 for second molar. That's why this tooth is tooth number 5, 5-1, 5-2, 5-3, 5-4, 5-5. Same with the other 6 quadrant on the left upper right, left upper quadrant, 6-1, 6-2, 6-5. Same sa lower gap. Again, I will repeat, for the ITDS, for the primary dentition, the first digit represents still the quadrant, and then the second digit for the specific tooth type. And I have, is this Ainslev?
Good morning, Doc. It's
Good morning. Ainslev. Okay, sorry. Ainslev. Name tooth number 7-2.
Come again, Doc. 7-2.
Yeah, 7-2.
Primary mandibular left incisor.
Come again. Primary.
Mandibular left incisor.
What incisor? Central or lateral?
Lateral.
Okay. Thank you.
Thank you, Doc.
Can you have Ernest John? Ernest John? Okay. Chat mo na lang. Tooth number 8-5. Name tooth number 8-5. Chat mo na lang. ba? Yeah, tooth number 8-5.
8-5. Primary mandibular right, second molar.
Okay, correct. Yeah. So, nakuha na ni guys sa ITDS.
Doc. Yes, Doc.
Yes, bro.
Okay. Now, let's proceed to Palmer's notation. Ang Palmer's is list used, guys. Di kayo siya gamiton lang. Ang Palmer's notation, they use symbols. They represent quadrant. Example kani. For this symbol, this represents the upper right quadrant. And then you have number 1, same regapon, central incisor, lateral canines, until third molar. However, nakalahi lang, it's number 1, there it's a central incisors on the upper right quadrant. On this side, ang quadrant, ang symbol lang lahi. Look at the symbols kung unsa siya. But this is just good to know. Pero dili kayo least used system. For the primary, they're using the same thing, symbols, and then instead of numbers, they're using letters. A for central, B, lateral, canine, so on and so forth. So tooth A with that symbol, that's a central incisor on the upper right quadrant. Just look at the symbol. But it's just good to know, guys, what Palmer notation is, or Zygmundi. I'll proceed to the next topic. Any question for tooth notation?
Done so far, Doc.
Okay. Tooth surfaces. Each tooth has 5 surfaces, guys. So let's discuss. So you have proximal. That's the collective term, proximal, or on the sides. You have mesial, and then you have distal. That's your midline. This is an upper arch, and then this is the midline, meaning the center. Any surface of the tooth facing towards the midline, we call it mesial. Again, any surface of the tooth that faces the midline is mesial. Away from that, any surface of the tooth that faces away from the midline is distal. Next, we have collective term. Again, we have facial, then you have labial and buccal. But there's a difference between labial and buccal. Okay, before I'll inform you that there are anterior teeth and there are posterior teeth. What are anterior teeth? Ang kanang canine to canine nimo, again from canines to canine, same with the lower, we call them anterior teeth. From your first premolar going to the third molar, we call them posterior teeth. So when I say anterior teeth, that's canine to canine. When I say posterior, that's first premolar to the third molar. Okay? Now for the labial, when you say facial surface or labial or buccal surface, these are surfaces facing the cheeks or the lips. Now, ang labial nga term, that's more applicable. Labial pertains to lips. Labial means lips, or labium, that's lips. When you say labial surface, that is only applicable for canine to canine, or basically applicable sa anterior nga ngipon, because your lips, naraman na sa anteriors. That's why labial ang term for anterior. Pero kung posterior gani, that's already facing the cheeks. That's why buccal. Buccal or pertains to cheeks, bucco or buccal. That's why again, any surface facing the lips, that's labial. Any surface facing the cheeks, that's buccal. However, the collective term is facial. So when I say facial, that's applicable to any, be it anterior or posterior. Nakuha niyo ang sa kalayan niya and sa term. Sure, nakuha ra? Or anyone nga wala pa ka-gets?
Nakuha lang daw.
Okay. That's why facial siya because they facing face or facewards. That's why facial. Pero to be more specific, that's labial and buccal. Labial for the anterior, buccal for the posterior. Next, we have cutting, lingual. Sorry, lingual pa. Lingual, we have lingual and palatal. When we say lingual, that pertains to tongue. Lingual or that's tongue. Palatal, that's palat. Any surface of the tooth that faces the tongue or faces the palate, we call them palatal. Now, please be mindful in strict terminology, these terms are not interchangeable. However, in the practice, magsige na gyud kay interchange ang lingual o palatal for as long as ni face siya sa palat or tongue. Pero again, in strict terminologies, the lingual surface is only applicable for the lower arch. Kaya ang lower raman ang naitang. Again, ang lingual pertains to tongue. Ang lower arch raman mo naitang. That's why ang lower nga ngipon lang, the lower teeth lang ang muana ka nga lingual surface. For the upper arch, naman dito ang palat, that's why we call it palatal surface. That's why you cannot say lingual surface of the upper molar or palatal surface of the lower molar. Again, in strict terminologies, ang lingual pertains to the tongue. Lower rana nga ngipon applicable. Palatal, upper, since it pertains to palat. Nakuha ni?
Yes, Doc.
Next, we have cutting. The cutting with incisal or occlusal. If it pertains to anterior teeth, canine to canine, the term is incisal. That's where you cut, you incise. For the posterior, the term is occlusal. That's where you bite. Again, incisal for the anterior, occlusal for the posterior. Any question for tooth surfaces? I guess discuss ninyo sa inyong laboratory.
Yes,
Can I
Doc,
proceed?
highlight.
Okay, can I proceed?
Yes, Doc.
Sige, let's try ko, no? Sige, can you say that what tooth is moving? Can you say that one tooth moving?
Yes, Doc.
Yes, Doc.
Sige daw. In ITDS, in International Two-Digit System, name the tooth. Tooth number 16. What is tooth number 6? Okay, is it right to say 16? In ITDS? Okay, that's tooth number 16. Name the tooth.
Primary.
Is it primary? There are premolars and molars.
Permanent. Maxillary. Right. First molar.
Correct.
Molar.
Okay, correct. Name the surface now of this tooth number 16. Name the surface. What surface is that? Okay, that one.
Distal.
This stuff.
That one.
Palatal.
Palatal. Kung ano ganun palatal, dililingual?
Because it's facing sa palate.
Okay, correct.
Pagdating sa tongue.
Correct. That part.
Bakal.
Bakal. Ano ganing labial?
It's not facing the
Posterior.
anterior, not just a posterior.
Okay, posterior. What is another term? What is the collective term?
Facial.
Facial. Okay.
Chan.
Buccal because it faces the cheeks. Collectively, we call it facial because it faces the face or facewards. That part, that surface.
Occlusal. Occlusal.
Okay, another tooth. Name the tooth. 90 DS. This is tooth number
2-1.
Name the tooth now.
Permanent maxillary central incisor. Central incisor.
TDS is permanent maxillary left central incisor. How about in ADA? Unsa na siya nga na tooth number? 9. Correct. That's 9.
9.
Name the surface.
Distal.
Correct.
Distal. Distal.
Okay. That one.
Cutting.
Incisal.
Cutting or?
Incisal.
Cutting is ano lang ha. That's the term lang. Pero the correct surface is incisal. Okay. So you can say cutting surface, but to be more specific, that is incisal. That one. Or palatal, not lingual. Okay. Then you have
Labial.
labial. Okay. Or facial. Labial or facial because that's the collective term. Can we say buccal? Can I say buccal surface of tooth number 2-1? No. Okay. No. Yes. Next, divisions into thirds. Divisions into thirds, guys, this is just imaginary lines where you divide the tooth in thirds. Again, imaginary lang ni. What is the purpose of dividing the tooth in thirds? For better understanding, para mas makasabot ka og dali. Like example, you locate something. That's why we divide the tooth in thirds. Okay. You can divide it in several ways. You can divide it cervico-apically or mesiodistally. You can divide the tooth, focus on the tooth. You have the cervical third, you have the middle third, and you have apical third. Cervical meaning neck. This is the neck part of the tooth. Same with the crown. That's the cervical, where the CHA is. You have their cervical, then you have middle third, and you have apical third. Because example, if I'll say there is a fracture of the root, again, for convenience and better understanding, especially when you communicate na dentist to dentist. For example, in the X-ray, nakita ang fracture of the root. The root is very large. Dako kayo ang root sa ngipon. Which part of the root man ang na-fracture? Let's say apical third. That's why you can say apical third root fracture of tooth number 1-1. This 1-1. This is permanent maxillary right central incisor. Okay? Or you can say there is radiolucency or a cyst or changes in the color, opacity on the middle third of the root. Then also for the crown, you can divide it cervical third, you have middle third, you have incisal third. You can also divide it mesiodistally. You have mesial third, you have middle third, you have distal third. Again, example, you have caries, naay caries. Which part of the crown? Because again, the crown is very large. To be more specific, which part? Example, this, can you say the arrow? That's why you can say there's dental caries naay daot sa incisal third and mesial third. Incisal third and mesial third. So that means naa diri ang iyang caries. Nakuha ra nga nung i-divide into thirds? Okay. As you can also divide it labiolingually. You have labial third, middle third. Sorry. example, you say there is a discoloration. Which part? Which part of the crown? You have labial third. You can also divide it buccolingually. You have buccal third, medial third, lingual third. Same with this, occlusal third, medial third, cervical. Remember, ayaw kalibog ang cervical ha. If asa to ang neck, mo na siya ang cervical. So therefore, this is the cervical part of the crown. Same with this, the cervical part of the root, cervical, medial, and then apical. Then mesial third sa crown, medial third, distal third. Okay. Proceed. Again, another good to know, point angles. A point angle is formed by the junction of the three surfaces. If three surfaces na gani ang combine, we call it point angle. Like example, kani distolabioincisal. There are three surfaces, right? You have your distal, you have labial, and then you have incisal. That's why there are three surfaces. We call it point angle. We have distal, we have lingual, we have incisal. So distolinguo-incisal point angle. Again, remember lang, if point angle gani, there are three surfaces. If there are three surfaces na apoy a junction of two surfaces, we call now it line angles. A line angle, again, two surfaces. Example kani mesial and then occlusal. So therefore, it's mesio-occlusal line angle. If distal and then lingual, then distolingual line angle. Again, if point angle, there are three surfaces. Line angle, there are two surfaces. Any questions so far? Okay, Ra?
Question, Doc.
Yes?
Will you be sharing this PowerPoint task?
Not the PowerPoint lang, but the screenshots.
Okay. Thank you, Doc.
Just remind me, okay? Can we have a 3-minute break? Maybe you want to drink coffee. We have crown and root anatomical landmarks. Take note of these landmarks, guys. Will be discussed. This is just an overview. It's good to know what cusps are, ridges, but we'll discuss further when we reach the specific tooth types in the next meeting. But just the basic, okay? Just good to know and be familiar with these landmarks. First, you have cusp. It's an elevation on the crown portion of a tooth making up a divisional part of the occlusal surface. Elevation means convexity. Ayaw kalibog ha? Bugdo. It means elevation, that's convexity, convex. When we say depression, laum or concave. Again, convexity, elevation. Depression, concavity. Cusp is an elevation, so bugdo or convexity on the crown portion of a tooth. Crown, and then you have a convexity. This is a cusp. On this part, this is also a cusp. Kanang mga blue, these are cusps. This is one cusp. This is another cusp. This is another cusp. This is another cusp. There are cusps. That's why making up a divisional part of the occlusal surface. Was that a chat? Okay, wala na. So again, that's the cusp. Next we have tubercle. It's a smaller elevation on some portion of the crown produced by extra formation of enamel. A tubercle is not really more of an anatomy but more of an anomaly. Again, a tubercle, this is not present always. However, all teeth can have a tubercle because again, this is not a normal anatomy but more of an anomaly. However, this is not a disease. This is a sakit. It's just a slight deviation from what is normal. That's why we call it anomaly. Any tooth can have a tubercle like this. Again, it's an elevation produced by an extra formation of enamel. That's why that's a tubercle. That is a tubercle. You'll know more when you reach oral pathology. You'll discuss diseases, dental anomalies. One is tubercle.
Doc,
Yes?
can we call the tubercle as deformities, Doc? Is it not? Counted as deformities?
Deformity? Can we call it a deformity?
Yes, Doc.
Not really more of a deformity. When we say deformity, there is a deformation or division of the form, but it's pwede sad siya, but in strict terminologies, normally we don't call it a deformity, but anomaly lang. Yeah, anomaly. But for now, yes, don't be too confused about that. You have your oral pathology with Dr. Isgara. You'll discuss anomalies and diseases of the tooth. Daghan pa yun. Daghan pa. Like, sa like, naay mga crowns sa ngipon nga ni-fuse, naay mga roots nga ni-fuse, naay overproduction of cemento, we call it hypercementosis. You have a crown trying to fuse. There are also crowns trying to divide. There are cementum nga ni-attach from one cementum of one tooth ni-attach to the other cementum. They're also very in large crown, large chambers. You'll have this in your oral pathology. It's a very interesting subject. Next, you have cingulum. Cingulum is the lingual lobe of an anterior tooth. Its convexity mesiodistally resembles a girdle encircling the lingual surface at the cervical third. Again, lingual lobe, or you can see palatal lobe. But again, interchangeable, but in strict terminology, lingual or palatal, you know that already. That's lingual lobe of an anterior tooth, meaning canines to canines. Convexity means bugdo at the lingual surface and cervical third. So again, this is a central incisor. Then it says lingual surface or palatal. And then at the cervical third and it says convexity bugdo. So that's why we call it cingulum. Again, all anterior teeth, be it upper and lower, sila tanan na ay cingulum. However, there are teeth that have very prominent cingulum. Dako kay cingulum. There are also poorly developed cingulum, mostly mandibular incisors. But we will talk about that next meeting. Again, that's good to note. Lingual lobe of an anterior tooth, that's a cingulum. This one, that's a cingulum. Nakuha ra niya sa cingulum. Actually, pwede na nyo matouch sa inyong tongue. There is a bulge sa inyong anterior ng ngipon. There is a certain bulge at the cervical or at the neck. That's the cingulum. Next ridge is any linear elevation on the surface of the tooth and is named according to its location. So we have marginal ridge. These are elevations, triangular, transverse, oblique. Let's discuss further. Marginal ridges are rounded borders that form the mesial and distal margins of the occlusal surfaces of premolars and molars, meaning marginal ridges can be found on posteriors, on the occlusal. We can also have on the proximal, mesial, and distal margins of lingual surfaces of incisors and canines. Therefore, can also be found on anterior teeth. Again, marginal ridges can be found on all teeth. For the posterior at the occlusal surface, for the anterior at the lingual surface. This. Again, rounded borders, meaning boundary on the sides. Mesial and distal. Mesial, distal of the occlusal ridges. These are elevations. You can also find it sa imong anteriors at the lingual surface. Remember, this is the cingulum. This is cingulum. There is still an elevation on the proximal, mesial or distal, kanang elevation. These are marginal ridges. Again, balikon ako. Marginal ridges of the posterior, mesial, distal, occlusal surface. Also with the anteriors on the lingual surface, you have elevations. These are marginal ridges. Next, we have triangular ridges. Descend from the cusp tips. From the tips of the cusp of molars and premolars toward the central part of the occlusal surface. Again, triangular ridges para rin sa posterior teeth. Again, tip. Again, descend from the tip of the cusp. So again, this is the cusp, right? One cusp. This is another cusp. So from the tip of the cusp, going down towards the center, that's the triangular ridge. This is one cusp. From tip, then going to the center, that's triangular. That's one triangular ridge. Here also, this one cusp. From the tip, going to the central part, that's another triangular ridge. Are you getting this? Nakuha ninyo nga sa illustration na a bit of elevation. Evident ba ang picture? Nakita ra?
Yes, Doc.
Again, triangular ridge from the tip of the cusp going to the center. That's triangular ridge. No? Para isa ka yellow, that's triangular ridge. Kanipot, that's another triangular ridge. Kanapot sila. Triangular ridges, triangular ridges. Basta from the tip of the cusp going to the center, na elevation, triangular ridges. Nasa transverse ridges is the union of the buccal and lingual triangular ridge crossing transversely the posterior surface of a posterior tooth. If a transverse ridge, guys, from the tip of the cusp going to the center, that's a triangular ridge. If you combine two triangular ridges that crossing transversely, we call it now transverse ridge. Kana. This is one triangular ridge, right? From the tip of the cusp going to the center. Tip of the cusp going to the center, triangular ridges. If you combine the two, mag-abot kayo sila, mag-meet. Combine, that's transverse ridge. Again, a transverse ridge is a union of the buccal and lingual triangular ridge. This is a buccal surface facing the cheeks. This is lingual surface. So this is buccal triangular ridge. This is lingual triangular ridge. If you combine nimo ang duha, that's already transverse ridge. Same with that. We have buccal triangular ridge, lingual triangular ridge. If you combine the two, that's transverse ridge. Nakuha ang kalahian sa triangular or transverse?
Yes, Doc.
Okay. Same with that, transverse ridge. Next, oblique ridge. It's a ridge crossing obliquely the occlusal surface of maxillary molars. Again, ang oblique ridge, makit-an ra sa maxillary molars. Now, what are these? It is formed by the union of the triangular ridge of the distobuccal cusp and the distal cusp ridge of the mesiolingual cusp. This is a bit confusing for now, but when you reach maxillary molars, our last topic, you'll be more familiar with the oblique ridge. But for now, it's good to note that oblique ridge, crossing obliquely or close sa surface and can be found on buccal cusp, this distal and this buccal, this tubacal, and then the distal cusp of the mesiolingual, this mesial or lingual or palatal. That's why buccal, this tubacal, and mesiolingual, oblique ridge. Ayos mo, don't be confused with this. For now, it's good to note that maxillary molars have oblique ridges. This is a very important landmark in doing your restorative treatment or ASPAC or mag-filling, and much more in doing endodontics or root canal therapy. You need to find this landmark. Ano sila? Oblique ridge. Ana, see that elevation, kanang ni arrow? That is the oblique ridge. Next, fossa is an irregular depression or concavity. We have lingual fossa, we have central fossa, we have triangular fossa. Lingual fossa are shallow depressions on the lingual surfaces of incisors and canines. Meaning, ang lingual fossa can only be found sa anterior or posterior. Ang saan nga ngipon ko siya pwede makita?
Anterior.
Okay, anteriors only. That one. Familiar gani o sa gani ngangan gani kani nga lingual at the cervical there is an elevation or convexity. What you call this?
Singular.
And then you have elevations on the mesial and marginal. The mesial and distal, we have marginal ridges. Ang kanang laom diha, that is now the lingual fossa. Kanang concavity or a depression, that's the lingual fossa. That means the lingual fossa is bounded by your marginal ridges on the sides, and on the top you have your cingulum. Again, bounded by marginal ridges, and you have your cingulum. Also, this one, what surface is this? Kanang may arrow. Cutting, it's a cutting surface. Incisal. So to make it complete, the lingual fossa is bounded by incisal surface or cutting surface. You have your marginal ridges, and then you have your cingulum. Onay boundary sa imong lingual fossa. Are we getting this? O saan yung mga lingual fossa? Again, anterior sa ni siya makitaan. These are lingual fossa. Marginal ridges, incisal. Again, marginal ridges, incisal, and cingulum. Next, we have central fossa, are depressions on the occlusal surface of molars. So, posterior sa siya makitaan, that one, kanang green. We have central fossa. Next, we have triangular. Lahi po ang triangular ridge, lahi ang triangular fossa. Are smaller depressions found on molars and premolars on the occlusal surfaces, mesial or distal to marginal ridges. This means that triangular fossae can only be found on posterior teeth. This one, this is the central fossa. Remember, katuganiha previously, this is the central fossa. Now, unsa man yung triangular fossa? Oh, depressions found on molars and premolars on the occlusal. We're facing the occlusal. This is a molar. Found mesial or distal to marginal ridges. These are your marginal ridges, right? Your elevations. Marginal ridges. And then, on sides, Beside the marginal ridges, you have your depression. Can you see depression here? Depression. That's the triangular fossa. Again, if this is the central fossa, basically on the center, on the sides, you have your triangular fossa. Be it, you have the mesial, and then you have the distal. So if this is mesial, what do you call this? This is mesial triangular fossa. If this is the distal part, this is the distal triangular fossa. Nakuha, what are triangular fossae o nganong triangular sila? Basically, these are triangular in shape. Guys, I hope you're still listening. We're almost done.
Yes, Doc.
Same with that kind of violet. Triangular fossa on sides of the marginal ridges. Next, same thing. That's triangular fossa. Next, we have groove, a linear channel. We have developmental groove and we have supplemental groove. This shallow grooves, a main difference between developmental and supplemental. Still, this is a common board exam question. What's the difference between developmental and supplemental groove? When we say developmental groove, again, they are the same, that they are linear channels. They are grooves. They are shallow grooves. However, when we say developmental groove, it's a shallow groove or line between the primary parts of the crown or root. Ang developmental groove, guys, going back to the supplemental lang ta. A supplemental to a developmental groove and does not mark the junction of the primary parts. A developmental groove, it marks the primary parts of the tooth. Ang supplemental groove, these are just supplements to the developmental groove and does not mark. So, a main difference niya, developmental groove marks the primary part or primary junctions. Ang supplemental groove does not mark the junction of primary parts. Sige, atong tanawon is this is a molar, this is a premolar. That is a developmental groove. Balik na. That is a developmental groove. Again, a developmental groove, it divides the crown into major parts. That's why this is a developmental groove na divide niya into major parts. This is one part, this is one cusp. This is another cusp, another cusp, another cusp, or another part. That's why a developmental groove, they divide niya ang crown into junctions or into main parts. However, ang supplemental grooves, kana bitong naa sa kilid-kilid, kana sila. These are just supplemental grooves. These are linear channels, small grooves, but they do not mark the main junctions or main parts of the crown. That's why we call them supplemental. Supplement lang. Again, akong balikon, a developmental groove divides the crown into main parts. The supplemental grooves do not. Are we getting this? Nakuha?
Yes, Doc.
Sabi daw. Frances Ann. Can you turn on your mic? Sige. Can I have Gabrielle Karen?
Yes, Doc.
Hello, good morning. Can you differentiate developmental from a supplemental groove?
Based on what I understood, Doc, a developmental groove is what is kind of a mark that helps you differentiate the parts that is visible on the crown, while the supplemental is the smaller grooves that connect to the developmental grooves.
But they do not mark the main parts of the crown. Okay, correct. Thank you. Can you have Geraldine Tisha? Geraldine? Can I have Jemima Kisha? Or what do you call, how do you pronounce your name?
Jemima po, Doc.
Jemima, okay. Can you differentiate triangular ridge from a transverse ridge?
Yung transverse ridge is two triangular ridges crossing transversely.
Okay, correct. Sige. I'll continue. Thank you. Guys. Let's try. Name what part is this? Sige, manawag lang ko, Ben. Can I have Josil, May?
Yes, Doc.
Name that one.
Nasa lipdan siya, Doc, sa kuan.
Sa lipdan sa?
Kanang PowerPoint slide, Doc. Ay, nara. Asa na part, Doc?
That one. It's a linear elevation found on the occlusal of premolars and molars, be it on the mesial or distal aspect. Found on the margins.
Marginal ridge, Doc.
Okay, correct. Marginal ridge. Can I have Joy Ann? Joy Ann? Wala. Sige, June Mark. Yes, daw. Good morning. Okay. Name that one. A linear elevation that descends from tip of the cusp going to the center. Triangular ridges? Okay, correct. Or triangular ridge. Thank you. Thank you. Can I have Jeanette Rose?
Stop.
Name that one again.
Wait, Doc, di makita. Wala. Wala nakita yung slide, Dok. Makita sa...
Naputol akong slides, guys. Di ba kita?
Yes, Doc. Di makita.
Vlog.
Sige, proceed na lang ta sa next. Sige, anyways. How about that? Makita na na?
Yes, Doc.
Yes, Doc.
Okay. Pits are small pinpoint depressions located at the junction of developmental grooves or at the terminal of those grooves. Kana sila. These are pinpoint depressions. Again, kana, these are pits. Kita mo naman ang itom, kana, these are pits. Can be found on anteriors, pwede po siya posterior, guys. Kung asan i-terminate mo mga grooves. Kani, what do you call this fossa?
Triangle.
Correct, triangular fossa.
Triangular fossa.
How about that? What do you call that?
Marginal groove, Doc.
Marginal ridge.
Marginal ridge. Marginal ridge. Kana. That's a pit. Okay? You have your marginal ridge, you have your triangular fossa, and then you have your pit. Same on the other side. You have marginal ridge, you have the triangular fossa, and then you have your pit. Therefore, ang pit can be found anterior, pwede mo siya posterior. Okay? Kana, what do you call that, guys? Can be found only on maxillary molars.
Oblique
Ang
ridge.
landmark is
First,
oblique ridge.
Oblique.
Very good. Okay, oblique ridge. Next, lobe is one of the primary sections in the development of the crown. Cusps and mamelons are representative of lobes. Kana. This is one lobe. That's why we call it medial lobe. We have middle lobe and we have distal lobe. In between the lobes, you have depressions. You have depressions. Can you see that you have depression? One lobe, depression. We have lobe again. You have depression. We have another lobe. It's good to note that the middle lobe is the largest lobe. Again, the middle lobe for the anterior, that's the largest lobe. Kana, mga lobes na sila. These are lobes. An anterior tooth, remember, tanang anterior tooth na ay 4 lobes. 1, 2, 3 on the labial, and then at the back on the lingual or palatal aspect, another 1 lobe. This part, this is a canine, and then this is the 4th lobe. That's why an anterior tooth has 4 lobes. Ang the rest, it depends na ay 4, na ay 5. But you will know more about this sa succeeding topics. Next, mamelon is any one of the 3 protuberances found on the incisal ridges of newly erupted incisor teeth. This one, kita na mo ani for sure. Kana, these are mamelons. Any protuberances found on the incisal ridges of newly erupted incisor teeth. Again, newly erupted. And I have Carl Denzel.
Doc.
Okay. As mentioned, mamelons can only be found on newly erupted incisors. Again, newly erupted incisors. But as we age, as we grow old, mawagtang na there will be loss of these mamelons. Even when you smile, wala na may mamelons. Question 1.
Maybe ang mamelon, sir, kay sa primary or other.
Can also be found on permanent, basta newly erupted incisors. Or even in the primary, pagka magkakuan as the child ages, magkawagtang ang mamelons. Question 1.
I think na like a word down lang, sir. I think. I don't.
Ma? Kasi term, ma?
Word down.
What spell the word?
WORE.
Correct. Past tense is aware. Correct, exactly. Because remember, we eat, we bite, we grind, we use our teeth. That's why there will be attrition. We call it attrition. Or the physiologic wearing and tearing of the tooth. When we bite, na may contact mo na mapudpud ang ipon. That is the same to any tires or kanang ligid. Di ba ang ligid, sa sige mo gamit, mapudpud. Even your phones, malugay, ma-abrade. Even, shoes. Sorry. Shoes, slippers. Di ba, magsige kang gamit, mapudpud. That's the normal wearing of the material. Same with the tooth. That's why mamelons can only be found sa newly erupted. Then age, mo flatten na ni siya. As we age, mo flatten. Nakuha is what mamelons are. Same with this, sa lower. Kita na mo, anir, wala. Aron ra. Ang uban, nakuha mo kita, tanaway yung mga manghod.
Kita na, Dok.
Ma-braid na siya, yung kay Bong, normal na siya. Even ganin ay uban karon nga dagko na pero nagapoy mamelons jud. These are mamelons. That's why in aesthetics, guys, in cosmetics, in veneers, crowns, especially sa interiors, they try to mimic the natural tooth o nabubutang sila og effect di ang murag mamelon-like. Can you see the translucency? Then you have eye changes nga murag ni curve. That is to mimic the mamelons, meaning youthful, youthful appearance. Okay. For the last topic, we have major contrast between primary and permanent teeth. Again, there are specific differences between primary and permanent, but let's talk about major contrast. What are the main difference of the primary and permanent? How will you determine if that's a primary or that's a permanent based on the anatomy? Okay. The crowns of primary and anterior teeth are wider mesiodistally in comparison with their crown length than the permanent teeth. This is self-explanatory. Wider sila in comparison with their crown length. Ang ila, mas lapad sila kaysa sa mas taas. Again, sa Bisaya pa, mas lapad kaysa sa mas taas. That's why wider mesiodistally than their inciso-cervical length. Compared to the permanent na almost equal lang. Pareha ang gilapdon, pareha ang gitaspon. Nakuha? Again, ang primary, wider mesiodistally than their inciso-cervical length. Compared to permanent, na almost equal. Di ka kaingon nga mas lapad o mas pagka. Next.
Doc, is it temporal incisor or lateral, Doc?
On this side, this is a mesial, this is pointed. This is a mesial surface and this is incisal. This is a mesio-incisal line angle. Remember, a line angle, a combination of two surfaces, right? This is a mesial, this is the incisal, the cutting. I-combine niyo mang duha, mesio-incisal line angle is sharper compared to the disto-incisal line angle, which is more rounded. Anyways, makarelate mo na sa next meeting. Next. The roots of primary and anterior teeth are narrower but longer in proportion for the primary. Next. The roots of primary molars accordingly are longer more slender and flare, more extending out beyond the projected outlines of the crown. Okay. Take note, this is a very huge difference, primary and permanent, especially can be seen through X-ray, and there is an explanation for this. Ang roots kuno sa primary are slender and narrower plus flared, meaning widely separated. Can you see the roots? The roots are widely, bilangkad kayo ba? Widely separated. Diverge kayo. Dili siya ni converge, but widely divergent, meaning flaring out, more extending beyond the projected outlines of the crown. This here crown, pero tanawa nga, widely divergent, split, compared to the permanent nga dili kaayong anak ka widely separated. Can I ask? Am I done with Kisha Godinez? Yes, Kisha. Why do you think the primary is widely separated? Ang roots niya. Can I have Kingsley John? Wala? Lady Kathleen. Yes? Any thoughts? Why are the roots of the primary are flared? Yes?
Hello, sir.
Yes?
My microphone is working, so then let's use this microphone. So, why is the primary seed or more flared?
I-unmute sa isa para dili mo feedback. Yan.
Probably because it is still primary, and soon it will the permanent it will erupt, so that's why it is more flared than the permanent tooth.
Okay. Actually, Kristen, you are right, but to make it more correct, ni flare siya, going back to the slides, ni flare ang permanent nga roots. It is because in order, this one kanina picture, this is already the permanent tooth bud. To accommodate the erupting permanent tooth bud, that's why ni flare ni siya to have a room, because as the permanent erupts, mo resorb niya ang roots, meaning ma-disrupt, iyang maguba ang roots sa primary until nga mo exfoliate, until nga matangtang ang primary, mupulin nila ang permanent. But that's the basic explanation why ni flare out ang iyang roots to accommodate or to have room for the erupting permanent tooth bud. Okay?
Oh, sir, thank you.
Okay. Keisha Godinez Codilia, how are you related to Dr. Jed Codilia? No connections? Do you know Dr. Jed Codilia? Are you familiar with Dr. Jed Codilia? Okay, but you're not related. Okay. Jed Cordelia, he ranked top 8 during the board exam. Last January, March 2022 board exam. Okay, anyways. Next, the crowns and roots of primary molars are much slender mesiodistally at their cervical portions. So, ang diri nga part, di ba, as I said, cervical, the CH, the neck, are slender sa primary compared that sa permanent. Most of ni slender siya because remember, ang roots niya ni flare out naman. That's why giving the appearance na constricted siya at neck, it is because the roots of the primary are also flared out, di ba, beyond the cervical crown projection. Constricted at neck because ang yung roots ni flare out na siya. Next, the cervical ridges of enamel anterior teeth are more prominent. Can you see that bulge? That's the cervical area, the cervical ridge of anterior that is more prominent compared to a flatter cervical ridge of the permanent. Next, the cervical, same with this, the cervical ridges buccally are more pronounced. More pronounced cervical areas. The crowns and roots of primary molars are much slender, same thing. Binalik, sir. The buccal and lingual surfaces of primary molars are flatter above the cervical curvature than those of the permanent molars. In other words, again, the buccal and lingual surfaces of primary molars are flatter, meaning the crowns of the primary are smaller compared to the permanent. It is because the buccal and lingual are flatter. Smaller, larger for permanent. The primary teeth are usually less pigmented and therefore white in appearance. If a permanent yellowish white, ang primary lighter than that, less pigmented and whiter in appearance. Do you have questions so far?
Wala.
Okay, do you have questions so far, guys? Wala?